Hey, this is Marc Milia. Thanks for taking a look at this video. I'm going to go over knee surgery, specifically meniscus and ACL surgery, and try and let you know what to expect when you're recovering in the process. One of the things I like to try and do during the process is make sure the patients understand what's going on, to know that they can communicate with us easily, and understand that I try and make myself as available as possible during the postoperative process through a lot of different methods. In general, meniscus surgery is more of a minor procedure. Crutches usually only need to be used for a day or two, and driving is not something that takes a long time to recover for, so usually a week you can drive a car. There's no brace after knee meniscus surgery. PT is usually optional, and if you do it, it's not usually more than for a month. I would say that you can expect to be able to ride a bike within a 10 to 14 day period, or to be able to even jog within 6 weeks. You can strengthen the knee around a month post-op, and things such as heavy squats or sports can be as soon as a month, but no longer than 3 months, depending upon which sport you like to play. ACL surgery is a little different. ACL surgery is more of a major procedure where we put in a new ligament inside the knee, and crutches can be used for up to a couple weeks afterwards. We also use that same protocol for people who've had cartilage transplantation or an MPFL surgery, which is a kneecap stabilization procedure. You can drive within 2 to 4 weeks, obviously depending upon which knee the surgery is performed on, as well as the type of car you have. A brace is usually not more than a week or two. We do use it up to 4 weeks if a meniscus is repaired in conjunction with the ACL surgery, or if you've had a patella stabilizing procedure. Physical therapy is usually around 3 months or more for range of motion and strength, but I do like to start physical therapy within 3 days of the surgery. Over the long run, you can usually ride a bike within a month of ACL surgery. You can expect to be able to jog by 3 months. Heavy squats are 3 to 4 months after surgery, not weeks. And plyometrics, such as jumping exercises, is about 3 to 4 months. Sports are 4 to 8 months, depending upon the sport. Brace for sports is usually for contact sports in the first year only, and we can discuss that around the 3 to 4 month mark after surgery. Now, one of the things that we like to do after knee surgery, especially ACL surgery, is stay in touch with the patient for up to a couple weeks afterwards with daily check-ins. We use an app called Get Well Loop. And so the day of the procedure that you see me in the office to schedule the surgery, we will collect information from you, such as your email or your cell phone, to decide how you want us to stay in touch with you. If you feel like you've missed this email or text message and you're watching this video in the postoperative or perioperative time frame, just send us an email at miliama@mosortho.com and we'll get in touch with you. This is what it looks like. These are 3 different cell phone screens. The one on the left is what your text message would look like, and then the one in the middle is how we would check in with you, and the one on the far right is what it looks like with the daily check-in. Now, if you look and you see where it says add comment, that is a way to send me a message in the postoperative period so I can answer questions that you may have that were not addressed with this app. Just in general, the surgeries are performed usually at one of 2 facilities. One is Beaumont Dearborn Surgery Center, which is across from the main Beaumont Dearborn Hospital. The other one is Surgeon's Choice Medical Center, which is in Southfield, Michigan. These are the 3 phone numbers of the 3 facilities that I do surgery out. So if you're not certain what time you need to arrive, or you have a question that has to do with the facility, the phone numbers are all on this page. So Surgeon's Choice is on the left, Beaumont Taylor is on the right, and Dearborn Surgery Center is in the middle. Before the surgery, it's not a bad idea to kind of prepare for things. It's a bad idea to wear shoes that are hard to get on if you can't bend your knee very well for that first couple of weeks. I strongly recommend stool softener or Benefiber, something along those lines, leading up to the surgery as well as the first week after, because constipation is real common just from receiving anesthesia in general. But just the lack of mobility that you're going to have and the pain medicine all promote constipation. Sleep aids such as melatonin or Advil PM are completely reasonable in that first couple weeks if you're having a hard time sleeping after the surgery, which is not uncommon. In addition to narcotic pain medicine, another way that we try and reduce the need for that is to give you something called a pain block or pain pump catheter, That is something that is introduced on the day of the surgery by the anesthesiology team. During that first day, you need to have crutches in your hand or wear a brace while the knee is numb so you don't fall or have any issues. But usually this device does not make it so that you can't control your knee. It usually just numbs it, but the muscles still work around the leg. It is important to take pain medicine before you remove it. However, if you've been very comfortable with it and you do not feel a lot of pain, you don't necessarily have to take pain medicine while you are receiving the pain pump catheter. This device delivers numbing medicine, not a narcotic, and it is a very helpful thing. You should be given a phone number for the anesthesia team the day of the surgery. It'll also come with an envelope with information in it. There should be a 1-800 number in there to address questions. Now, for some reason you don't have the ability to find that information, there's actually a video. You could see the Vimeo address. If you watch that video, it should explain a lot of the details about the ambit pain pump catheter that you'll go home with. We generally only use this in ACL surgery, not meniscus surgery. You can watch the video, but I'm going to actually skip ahead here because it takes too long. But just so you know, this video does exist. Now, some of the facilities do provide ice units. The Dearborn Surgery Center, since they're providing the catheter, in general does not provide an ice unit, but you can see you can buy one on Amazon. A lot of people just choose to use bags of ice intermittently. I would recommend, if you're using a bag of ice, to not put it on your extremity for more than 20 or 30 minutes because it can freeze your skin. So definitely put it on your ACE wrap and not directly on your skin. And that is an optional device that a lot of people do find helpful. Pain medicine can be optional after the first few days. Most people who have ACL surgery don't need pain medicine after a week. And knee scope patients generally don't need it more than a few days. And if you can avoid pain medicine altogether, it's definitely better for your GI tract. You won't get constipated as frequently if you don't take narcotic pain medicine. An alternative to that is obviously Motrin, Advil, Aleve, those anti-inflammatories you can get over the counter. If you are taking the narcotic pain medicine, you obviously should avoid alcohol. You shouldn't operate a vehicle. And you really shouldn't take more than a maximum of 8 pills per 24 hours. It can be hard on the liver. 3,000 milligrams is the maximum of acetaminophen in a 24-hour time frame. So narcotic pain medicine generally has acetaminophen, so you want to be careful with taking any additional Tylenol in addition to the pain medicine. Like I mentioned, ibuprofen is a great adjunct, and it can be taken in conjunction or even in substitution for narcotics. Maximum ibuprofen is 800 milligrams every 8 hours, but you need to be careful of it if you have any history of kidney disease or any prior history of stomach issues or bleeding in your GI tract. Now, when we do knee surgery, we generally recommend blood clot prevention of aspirin once daily for a couple weeks. If you have any type of sensitivity or allergy to aspirin, you need to let us know before you leave the facility. And if you've personally had a deep leg clot or a chest blood clot or some kind of an extensive hereditary history in the family, it would be important to let us know that before you leave the facility so we can address it appropriately. Knee exercises help restore the range of motion and strength. It also helps prevent blood clots in the legs, and I would recommend doing at least 10 reps 3 to 4 times per day when you're not in physical therapy or where you're waiting to start physical therapy. So if you're at home, you can actually do these on your own. This is called the heel slide. Now, if you have a brace on your knee after your ACL surgery and you feel comfortable unlocking the brace, you can unlock the brace, or you can literally just remove the brace just to slide your heel up. That way you're bending your knee and not immobile all the time. And I would say 3 to 4 times per day, 10 reps per minimum for each time that you do it. Another exercise that's very helpful is something called a straight leg raise. You can do that when you're in your knee immobilizer after ACL surgery. And certainly you can do it also without a brace if you are recovering from meniscus surgery. Now, in terms of application of a ACE wrap to the knee, it's preferable that you wear the ACE wrap on your knee for the first week or so after ACL surgery. And all this video is showing is how to wrap it from the bottom to the top. I would like people, anytime they're wearing a knee brace, to be in the ACE wrap. Meniscus surgery, on the other hand, really only needs an ACE wrap for the first day or so. Now, a knee immobilizer is important only in ACL surgery. Now, in this video right here, a young lady is applying the brace. Now, this would be too low, this would be too high. You basically want to have the hinges directly across from your kneecap, and each band of the brace can be adjusted. You usually want to start from the one that's just below the kneecap, then the one that's just above the kneecap, and then you go the most distal one closest to the ankle, and then the thigh one at the end. And then to lock the brace, you actually push down on your thigh to lock it. So that little orange button that she is showing that she pushed is what locks the brace fully extended. You can actually unlock the brace by pulling it up top as well, but we usually like to wait until you're at least a week out from the surgery. The brace just gives you stability when you're walking, so if you trip or fall, you won't hurt your knee. Now finally, when you have just meniscus surgery, you can really remove the ACE wrap one day after surgery. So taking it off a day after surgery is fine. There should be steri strips in your knee covering your incisions. If there are sutures that you can visibly see, you're going to want to put band-aids over those. Now ACL surgery is a little bit different. Since you have usually a pain pump catheter, we like to keep everything on for the full 3 days. On the third day, when you remove the pain pump catheter, you can remove the ACE wrap off your knee and any bandages. You can subsequently get your incision wet on that third day, but leading up to surgery, you really shouldn't take a shower or get your leg wet if there is any kind of pain pump being utilized. After you have physical therapy and you're much more comfortable without a brace, you can remove the ACE wrap and take a shower without worrying about it getting wet. It's better to do that when you're seated for those first couple of showers. And I'd like you to leave all the steri strips intact as long as you can, at least a couple weeks. Now the pain pump catheter is really just a very small thing that's about the size of a fishing line that should be in your thigh. It's held in with band-aids. When you remove it, all you do is you just basically peel off the tape and pull the little thing that's coming out of your thigh and put a band-aid on it. It usually just comes out without even trying because it's all stuck to the tape. There's no bleeding that will occur. It will not cause any pain. It's very normal for you to have numbness in the front of your leg even after you've removed that, but everything should be functional in your foot after this has been removed. If you are having any questions or problems with this device, whether the catheter isn't working properly or you feel like it's not functioning properly, these phone numbers are the numbers to all the facilities, and you want to ask for the anesthesiologist who is handling the catheters that were placed. If you still don't have a solution and you're trying to get through to me, the best way is really to start with Get Well Loop first. It's going to be often quicker than calling the office. We usually get back to people within a couple of hours with Get Well Loop. If there's really no response or you're having a hard time getting through, you should call my main number and then extension 340. She can get in touch with me. And then after 5 p.m., you call the after hours number, which is 313-396-0547. If you're having issues, I can see you the next day to remove the catheter. However, once again, it's the anesthesiologist's responsibility in general, so you should contact them first, but I'm happy to help if you're getting frustrated with any contact. Now in terms of the incisions, once again, an ACL surgery is more like the top. You should see band-aids on your knee. Meniscus scope surgery, the band-aids are going to be a little bit less obvious and smaller. Very seldom do I use regular sutures. I usually use absorbable suture under the skin covered with steri strips. I'd like to try and leave them on for a couple of weeks if possible. Once that catheter is out, once again, you can shower with the catheter out, and then you can remove all the steri strips a couple of weeks later. Now just in general, athletes after ACL surgery need at least a week off from school, sometimes longer. Operating a vehicle should be avoided while using pain medicine or while your leg is in a brace, and it's obviously 2 to 4 weeks depending upon which knee. So if it's your left knee and you can get in and out of your car, you should be able to drive within a couple weeks. For the right knee, it's at least a month. And if you just had a meniscus surgery, there's really no reason you can't drive the day after if you're not taking pain medicine. And returning to work really depends on your ability to work on a number of factors. First of all, what your level of discomfort you're having and how much demand your job puts on your leg. So Try to avoid work until seen in the office for jobs that require all-day standing. It may be a couple more weeks for meniscus scope surgery, and it may be a few weeks for ACL surgery. And we should obviously have addressed that for you if you have any questions. Now, for the first few meals after arthroscopy, you really should kind of take it easy. And once again, consider stool softener. Constipation is pretty common after anesthesia and pain medicine. Now, if you have any of these problems, I'd like you to call us. So redness or drainage from the incision or excessive swelling that's causing a lot of discomfort, you should let us know. If you have a temperature over 101 without an apparent cause, or if you start having redness or swelling in your calf, if you notice numbness or weakness in your arm, in your leg that's not explained by a preoperative block, and you're concerned, you can certainly let us know. And once again, these are the contact phone numbers after hours, during the daytime. Email is a final alternative, and once again, Get Well Loop is an excellent resource to get in touch with us. That comes directly to my phone and my physician assistant's phone. You should be coming to see us a week or two after the surgery. If you didn't have an appointment already made, you can certainly call my scheduler at extension 340, and then the email for the scheduling department is noted here, miliaschedge@MOSortho. That's a great way to get in touch with us without having to be on the phone. Now finally, if you have questions that occur during the day, there's 3 different ways. Once again, you can just add a comment through the Get Well Loop. You can call us at that extension, or you can email my assistant. And then once again, the after hours phone number is 313-396-0547. Hopefully this video will alleviate any questions or concerns that you have, and I appreciate you watching.